The Ebola virus causes an acute, serious illness, which is often fatal if untreated. Ebola virus disease first appeared in 1976 in two simultaneous outbreaks, one in Nazara, Sudan, and the other one in Jambuco, Democratic Republic of Congo. The latter occurred in the village near the Ebola River, from which the disease takes its name. The current outbreak in West Africa, first cases notified in March of 2014, is the largest and most complex Ebola outbreak since the Ebola virus was first discovered. There have been more cases and deaths in this outbreak than all others combined. It has also spread between countries starting in Guinea, then spreading across the land borders to Sierra Leone, Liberia, by air to Nigeria, and by land to Senegal. The most severely affected countries, Guinea, Sierra Leone, and Liberia, have very weak health system, lacking human and infrastructural resources, having only recently emerged from long periods of conflict and instability. On August the 8th, the World Health Organization Director General declared this outbreak a public health emergency of international concern.
Bundi Bugyo Ebola virus, Zaire Ebola virus, and Sudan Ebola virus have been associated with large outbreaks in Africa. The virus causing the 2014 West African outbreak belongs to the Zaire species. It is thought that fruit bats of the Pteropodidae family are natural Ebola virus hosts.
Ebola is introduced into the human population through close contact with the blood, secretions, organs, or other bodily fluids of infected animals. Ebola then spreads through human-to-human transmission via direct contact through broken skin or mucous membranes with the blood, secretions, organs, or other bodily fluids of infected people, and with surfaces and materials contaminated.
Healthcare workers have frequently been infected while treating patients with suspected or confirmed Ebola virus disease. This has occurred through close contact with patients when infection control fails. Burial ceremonies in which mourners have direct contact with the body of the deceased person can also play a role in the transmission of Ebola.
People remain infectious as long as their blood and body fluids, including semen and breast milk, contain the virus. Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery from illness.
The incubation period, that is, the time interval from infection with a virus to onset of symptoms, is 2 to 21 days. Humans are not infectious until they develop symptoms. The first symptoms are sudden onset of fever, fatigue, muscle pain, headache, and sore throat. This is followed by vomiting, diarrhea, rash, symptoms of impaired kidney and liver function, and in some cases, both internal and external bleeding.
Laboratory findings include low white blood cell and platelet counts and elevated liver enzymes. It can be difficult to distinguish Ebola virus disease from other infectious diseases such as malaria, typhoid fever, and meningitis. Confirmation that symptoms are caused by Ebola virus infection are made using the following investigations: ELISA, antigen capture detection tests, serum neutralization test, PCR assay, electron microscopy, virus isolation by cell culture.
Samples from patients are an extreme biohazard risk. Laboratory testing on non-inactivated samples should be conducted under maximum biological containment conditions. Supportive care, rehydration with oral or intravenous fluids, and treatment of specific symptoms improve survival.
There is as yet no proven treatment available for Ebola virus disease. However, a range of potential treatments, including blood products, immune therapies, and drug therapies, are currently being evaluated. No licensed vaccines are available yet, but 2 potential vaccines are undergoing human safety testing.